If you think back to when you first started medical training, you may remember learning about how to have a good bedside manner or the best way to interact with patients. This skill was emphasized because bedside manner is quite important. It can have a positive impact on patient outcomes, and bad bedside manner is one of the most frequent patient complaints. The telemedicine equivalent of bedside manner is website manner. It is equally important, but more challenging, as communicating in person tends to be easier than communicating virtually. You should dress and behave professionally. This may or may not include wearing a white coat, depending on your preference and practice. Don't eat or drink during the visit, and make sure you won't be interrupted. If you work from home, this may mean having specific child and/or pet care plans set up. Start the visit by introducing yourself and asking how the patient is doing. Then set the agenda for the visit. During the visit, avoid using medical jargon that may confuse or frustrate your patient. Keep an eye on the time so you're able to summarize the visit before the appointment ends. With in-person care, you can use verbal and body cues, whereas in telemedicine, verbal cues are much easier for the patient to notice. One phrase I find helpful is, "I want to be mindful that we have 10 minutes left in the appointment, so we use this time well." You can then transition to the most urgent topics yet to be covered, or move on directly to discussing next steps. If having an asynchronous visit, be very mindful of how you phrase things. Just like texting with friends, tone can be hard to determine in the written form, and misunderstandings can occur. If you notice that your patient seems to be frustrated or confused, offer to call them if possible. A phone call often helps de-escalate these situations. Whether on the phone or video, verbal cues are very important. Make sure to use active listening skills, such as saying yes, to indicate you are listening, or repeating items back to your patient. One of my favorite phrases to use here is, "What I'm hearing is," followed by what you took away from the patient, and then asking, "Is this correct?" Empathetic statements have increased importance in telemedicine as you build relationships with your patients virtually. On video calls, eye contact is very important. But remember, you have to look at the camera, not the image of the patient on your screen, to make eye contact from the patient's perspective. Body language, as far as it can be seen on video, also plays a large role in website manner. Avoid fidgeting, which can make you appear distracted, slouching, which can make you appear disinterested, and crossing your arms or raising your eyebrows, which can make you look angry. Remember to smile when appropriate and nod your head when you're listening. Website manner is important for building the best relationships possible with your patients.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.